Hi everyone, this is Vicky from NP Reasoning, and today I'm going to talk to you about diagnostic frameworks. So, essentially, how to apply diagnostic frameworks to any clinical case that comes in front of you. There is no need to wing presentations when we see patients. We should essentially always be using some form of diagnostic framework to guide us through that presentation. So, again, we're going to learn how to create these diagnostic frameworks for common presentations. It's important to highlight that it's not a one size fits all. So, I'm going to present what types of frameworks you can use. And it's really about you experimenting and figuring out what frameworks work well for you given the current presentation in front of you. So, let's get into it. So, really, how do we create differential diagnoses, right? We're not winging it, we're not pulling things out of thin air. We use our knowledge base about disease and we create these diagnostic frameworks for various clinical presentations. So, the four common frameworks used in medicine are the systems framework, the mechanisms framework, the anatomic framework, and the checklist mnemonic framework. Again, really important to highlight that it's not a one size fits all. It's really up to you to figure out what framework works best in your brain to organize a case in front of you. And I'll go through many case examples of what I mean by this. And lastly, the checklist mnemonic framework, I think we're all familiar with. This is one, sometimes we want to be careful with this one because it can certainly miss things, but the mnemonic checklist framework can easily be embedded on top of another framework that we're using for a presentation, but occasionally it can be used alone as well. A classic one is the palm coin mnemonic that is used for any female presenting with abnormal uterine bleeding. So in this case, you're seeing an older female postmenopausal with abnormal uterine bleeding. So we think of the palm coin, right? And as you can see, it's spelling out PALMCOEIN and the associated possibilities or etiologies of that abnormal uterine bleeding. And it's essentially breaking it down into structural things that could be causing it: polyps, adenomyosis, leiomyoma, which are fibroids, malignancy, and then non-structural causes like coagulopathy, etc. Last example for this framework here is, person again presenting with back pain. So the nifty mnemonic, which comes from the core back tool, helps us remember those red flag diagnoses we would never want to miss with an acute low back pain or any type of low back pain. So again, thinking about neurological, we're wanting to rule out Cauda-Equina syndrome, people presenting with progressive neurological deficits. Infection, we're ruling out fever, IV drug use, concern for an epidural abscess, etc., etc. So that nifty mnemonic can also be used to help you determine whether there's any red flags for back pain. So, key take home points again, just use these diagnostic frameworks to guide your clinical decision making even before you set foot in front of that patient. As you get better and as you gain more experience and see hundreds and hundreds of patients, you'll know what framework works and you'll become way more attuned to what you need to ask in those visits. You can use, again, a combination of these frameworks for the same presentation. And again, use a framework that works best for your brain. So it takes a lot of experimenting and figuring out, what your brain's going to remember, and just really experiment with cases and see what works best for you. That's what I've done, in my years of practice, and you certainly get better with it and you refine it as you go along. Thank you so much. Be sure to visit npreasoning.com for more written blog content and other family medicine, primary care updates. Thank you so much, everybody.